Good morning to one and all present here for the great event on the Myofascial trigger point release therapy level 1 workshop. I request the dignitaries on the dais and all the delegates to kindly rise for the Tamilthai Varthu.
சீராரும் வதனமென திகழ்பரத கண்டமிதில் தெக்கனமும் அதிசிறந்த திராவிடனர் திருநாடும் தத்த சிறு விரைநுதலும் தரிதனரும் திலகமுமே அத்திலக வாசனை போல் அனைத்துலகும் இன்பமுற எத்திசையும் புகழ் மணக்க இருந்த பெரும் தமிழனங்கே தமிழனங்கே உன் சீரிழமை திரும்பியந்து செயல் மறந்து வாழ்த்ததுமே வாழ்த்ததுமே வாழ்த்ததுமே.
I, on behalf of Faculty of Physiotherapy, Dr. M.J.R. Educational Research Institute, take immense pleasure to deliver the welcome address for the 2 days hands-on workshop on Myofascial trigger point release therapy level 1. At the outset, I would like to extend my cordial welcome to Honorable Founder Chancellor, Dr. A.C. Shanikam sir, Honorable President, Engineer A.S. Kumar sir, who constantly motivates us in all our initiatives. I extend a pleasant welcome to our most respected and beloved Honorable Secretary Sir, to A. Ravikumar sir, who always strives hard for the benefit of the student community. Welcome sir. I extend a warm welcome to our respected Vice Chancellor, Professor Dr. S. Geeta Lakshmi Madam, Professor Dr. C.S. Jayachandran, Advisor Sir, Medical Superintendent, Professor Dr. J. Krishnamohan Sir, Professor Dr. V. Palli, Director of Hospitals, Professor Dr. Tehna B. Jolia Ma'am, Dean ACS Medical College, Special Officer Dr. K.KIRUPA MPT, PhD, IAS retired sir. I am elated to welcome our resource person, Dr. SURESH FRANKLIN, Founder and Director, Synergy PhysioCare and Rehab Center. I extend a warm welcome to our beloved Principal, Professor Dr. C.V.SENTHIL sir, Vice Principals, faculty members and dear students. Once again, I welcome you all to join with us and make this event a grand success. I humbly request all the dignitaries on the dais to light the Kuttuvilakku. Faculty of Physiotherapy, Dr. M.J.R. Educational Research Institute organizes a series of workshops at 50 guest lectures under the benevolence and guidance of Honorable President Sir and Honorable Secretary Sir, who continuously motivates us in all our endeavors. With the blessings and motivation of our beloved and Honorable Secretary Sir, our faculty members and students have excelled in both academic and extracurricular activities. 2 of our faculty members have received money for Rs 2,50,000 each for the last academic year. For the current academic year, 5 projects were selected and an amount of Rs 12 lakhs was sanctioned. Our department has a patent with Dr. V. Rajalakshmi, Vice Principal on Food Dynamometer. Our students have received overall championship in Spectra 2K18 along with ACS Medical College. We are very happy to share that our students have bagged the overall championship in 4 National Interphysiotherapy College Sports Meets organized by SRM College of Physiotherapy. Our own students are holding this overall championship trophy for the second time. It's time to felicitate. My request our beloved Principal, Professor Dr. C.V.SENTHIL sir, to felicitate our own respected Honorable Secretary, Sri A. Ravikumar sir. Secretary sir will now felicitate our resource person, Dr. SURESH FRANKLIN, Founder and Director, Synergy PhysioCare and Rehab Center. I request our beloved Secretary sir to distribute the trophy for the winners of the 4th National Inter-College Physiotherapy Sports Meet conducted by SRM College of Physiotherapy. 100 meters running winner was M.Divyashree. 1500 meters running winner was Pavitra. Silambam winner was P.ANUPREETHI. 100 meters relay runners L. Subbaya, P. Vijay, Mr. P. Madhavan and Gopal. The recorded captains, volleyball winners captain was M. Myofascial. Throw ball runners captain N.B. Kirti-Priya. Kho-Kho winners captain R.NITHYANISHA. Basketball winners captain Mr. V. Karthishwaran. Throw ball captain N.B. Kirti-Priya and team. Kho-Kho winners captain R. Kritika and team. Basketball winners captain Mr. V. Karthishwaran and team. Football runners captain Mr. P. Naveen Kumar and team. Special awards, best player Mr. Sanjeev, 1500 meters. Special award for Mr. Sanjeev. Mr. Nityananda, special award, best player for basketball. And we have Ms. Lavanya for throwball and Ms. Kritika for Kho-Kho. It's high time to extend our appreciation to the students who showed tremendous contribution, dedication, passion and hard work towards the media promotion and technical support for our official YouTube channel named Dr. MJ Physio. Here comes the team of technical support, Mr. R. Shivkumar, Mr. A. Robinson, Mr. J. Kumani, Mr. S.A. Srinraj, Mr. Sujay Samuel, Mr. Muthu Prem Kumar, Mr. Venilavan, Mr. Shivaguranajan, Mr. A. Kaving, Mr. R. Navi, Mr. Jnanamurthy, Mr. Shruti Priyan, Mr. Remo Biswas, Mr. Charan, Mr. Hari, Honorable Secretary Sir to give the overall championship, and I ask all the student representatives to please come and take a photograph. I invite Dr. K.KIRUPA, Assistant Professor, Faculty of Physiotherapy, to propose the vote of thanks.
Hello everyone, I'm so pleased to be with you and it's my privilege to have been asked to prepare a vote of thanks on this occasion. It gives me immense pleasure to thank our founder, Chancellor, Dr. A.C. Shanmugam sir. Though he is not here with us due to his busy schedule, his blessings are always there for us. Thank you sir. My heartfelt thanks to our Honorable President, Engineer A.C.S. Arun Kumar sir, Honorable Secretary A. Ravi Kumar sir, who has been encouraging, guiding and providing a stimulating environment for the education development. It is their vision and leadership that has brought revolutionary changes. Our thanks and respect to you sir. Thank you sir. I would like to express my heartfelt thanks to our Vice Chancellor, Professor Dr. S. Geetharulogachanda Madam for her constant support, guidance and encouragement. We also thank our advisor Dr. C.S. Jayachandran, Medical Superintendent, Professor Dr. J. G.MOHAN, Dr. B. Palani, Directors of Hospital, Professor Dr. Pregna B. Dolia Madam, Dean, ACS Medical College, Special Officer Dr. K. Dhanaven, PhD, IAS retired. A speaker who talk about what life has taught him never failed to keep the attention of the listener. A big thankful to the speaker, Dr. SURESH FRANKLIN, Founder and Director, Synergy Physio Care and Rehabilitation Center, Chennai, who speaks in such a way that others love to listen. Thank you, sir. I would like to extend my gratitude to our principal, Professor Dr. C.V.SENTHIL sir, PhD, Faculty of Physiotherapy. He is the person that is not about having power over others, but about instilling power in others. Hence, our physiotherapy department is always unique and excellency in all the momentous events. Thank you, sir. I also extend my thanks to our Joint Registrar, Vice Principal Dr. S. Veena, PhD, Dr. B. Rajalakshmi, PhD, Vice Principal for the enormous cooperation in this event. I would also like to thank Dr. G.MOHAN Kumar PhD, Dr. S.SUDHAKAR PhD, Organizing Secretary, Dr. G.THIRULOGACHANDAR Association Convener, and sports team faculty Dr. S.M.DIVYAMARI, Dr. G.THIRULOGACHANDAR, Dr. D.MONESH, and ortho team Dr. G.YUVARANI, Dr. K.KIRUPA, Dr. R.NITHYANISHA, Dr. EBENEZER, Dr. P.ANUPREETHI. An event like this cannot happen overnight. This bill starts rolling 2 weeks ago and it requires planning and a bird's eye for details. We have been fortunate enough to be backed up by a team of very motivated and dedicated ortho sports team and also other faculties of physiotherapy, Dr. MGR Educational and Research Institute, I thank everyone for the involvement of their willingness to take the completion of tasks before their comfort zone. Thank you and thank you all.
Thank you, Dr. Kripa. I request every one of you to kindly rise for the national anthem.
विनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय दाता जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
This is Franklin representing Synergy Physiotherapy and Rehab Center, and founder and director of Synergy Physiotherapy and Rehab Center. I'm very happy to be here, and this is from the sports physiotherapy and specialization. I'm the physiotherapist for the Indian MMA team for the year 2022, where we have won the bronze medal for the country when we were there in the Jan 2022. Alright. And here I'm been invited into Dr. Injar University Research Institute and ACS College for addressing on these topic called as trigger point release, which is otherwise called as muscle knots. Most of the injuries in terms of sports or pain management, it's all about dealing with these kinds of muscle knots. How do we deal it, and how do we identify them, and how to make them to release that muscle so that the recoveries are much faster, so that the rehabilitation can be started very easily. So the betterment which we take this process to the students to understand that the recoveries can be better, so that the society can be much beneficial. Thank you so much. Let's get into the workshop and let's do big things. Thank you.
Okay, so welcome you all for a wonderful session of trigger point release. Okay, the more the session becomes very interesting. Okay, trust me, this is not yet another workshop. இதுக்கு முன்னாடி நீங்கள் கேள்விப்பட்ட நிறைய ஒர்க் ஷாப் மாதிரி இது கண்டிப்பாக இருக்காது. ஓகே, எப்படின்னா அங்கே இருந்துட்டு அப்படியே தூங்கிட்டு சாப்பிட்டு போயிடலாம் வாய்ப்பே கிடையாது ராசா. ஓகே, ஏன் அப்படின்னா I will know what is coming up. Okay, and what am I going to do with you? It's what exactly what we are going to push it on. Okay, so the more we are getting into the interactions, the clinical aspects, and your experience towards or your approaches towards a problem of any pain management or sports injuries, we will discuss. Okay, and this workshop is something which is making you going to understand at one point of time, do we really need a mission to work in physiotherapy? You will answer this question. Okay, so Synergy Physiotherapy and Rehab Center, okay, the founder and director. Okay, we are from 2013 to 2022 and keep going on. We are 9 years plus and we are keep moving and growing. Okay, one of the best specialty about our clinic is right from the day one, very proudly I will say, we never use machines for treatment. Neither a traction, nor a AFT, nor a laser, nor a SWD. Nothing is there in the clinic, only a couch and a chair. Our successful ratio is 97.36. Okay, so how you going to do it? Thank you, I'll give you time to clap. It's okay. Good. So how we do it? It's all about how you approach a problem and how you quickly diagnose the problem. The diagnosis is the key. And that diagnosis, if you're going to do it precisely, and your results are phenomenally great. Okay? The people who work with or the people who have trained with us, somebody in conservative management, if you're going to bring the problem down the line in 10 years, 10 days or 12 days or 13 days, the same recovery can be happening in 4 to 5 days. After time cut. How are you going to do that? That is what we are going to discuss in the next 2 days. Okay? Right. So, shall we go ahead? Good. Okay. I give a pointer. Pointer. Change up. Okay. Right. Change. Change faster. Change. Change. Okay, so this workshop is all about muscle. One more click. Okay, so this workshop is all about muscle knots. But yeah. Okay, so the other way, எங்களுக்குமே செட்டில் ஆகிறது கொஞ்சம் டைம் எடுக்கும். ஓகே, அதனால இந்த இவ்வளோ கேஸ் நடக்குது. ஓகே, ஏன் அப்படின்னா ஒரு டைமில் அந்த ஃப்ளோ எடுக்கிறதுக்கு எனக்கு கொஞ்சம் டைம் எடுக்கும். ஓகே, டெஃபினெட்லி அந்த ஃப்ளோ எடுத்தனா வச்சு செஞ்சுருவேன். ஓகே, அது ஜாலியாக இருக்கும், பார்த்துக்கலாம். ஓகே, வந்துச்சாப்பா? ரைட். இதுக்கப்புறம் கண்ட்ரோல் நம்ப இல்லை. Okay, good. So this is what we are going to learn for the day, muscle knots. Okay, so it's otherwise called as trigger points. Why do we have to learn trigger points, and what is this small intro about trigger points is what we are going to learn now. Okay, I'm going to give you a very small intro about trigger point, and eventually we will go with what we are going to do next. Okay, very small introduction about trigger points. Okay, right. So 60% of the human body is made about muscles. And there are only two type of people, or majorly three type of people. Ectomorphic, நீங்களே கூட கோஆபரேட் பண்ணுங்க. Endomorphic and mesomorphic. Okay, ectona என்ன? ECTO. Ectona? லீனா? சத்தியமா சொல்லுங்க, எத்தனை பேர் இன்னும் வரைக்கும் இந்த கன்ஃபியூஷன் இருக்கு? எக்டோனா என்ன? கை தூக்கலாம், தப்பே கிடையாது. பத்தியா? தலை கை தட்டுங்க, ஒத்துக்காதுல்ல, அது முக்கியம். பிசியோதெரபி முடிச்சு வெளில வர வரைக்கும் எனக்கும் இந்த டவுட் இருந்துச்சுதான். ஓகேவா? எக்டோனா என்ன, எண்டோனா. ஸோ பட் இட்ஸ் வெரி ஈஸி டு அண்டர்ஸ்டாண்ட் அண்ட் த லேர்னிங் இஸ் ஆல் அபவுட் கிரியேட்டிவிட்டி. வேற எதுவுமே கிடையாது. எக்டோ டீல், தின் அண்ட் டால், அவ்வளோதான் மேட்ரு. ஓவர் இதை யாரும் சொல்லிட்டாங்க சாமி. எண்டோ இஎன்டிஓல டீல ஒரு தொப்பை இருக்கு பார்த்தீங்களா? ஓபிசிடி, அவ்வளோதான். இதுக்கப்புறம் மறக்காது. Learning is all about creativity. It's all about how you learn. As just simple as mesomorphic, as you know, it's all about musculature or normal proportioning. Okay, right. Okay, and anything which moves a lot. For example, in a car, which part of the car worns out a lot? Wear and tear எங்க அதிகமா இருக்கும்? டயர். ஏன்? ஏன்னா அதிகமா மூவ் ஆகுது. காருக்கும் ரோடுக்கும் நடுவில் மாட்டிங்கன்னா அதிகமா மூவ் ஆகுது யாருன்னு பார்த்தீங்கன்னா டயர் தான். Right? அதனால இதோட wear and tear வந்து அதிகமா இருக்கு. It's exactly the same way in muscle. The movements has been, or the body, the movements has been taken care by the muscles. When something which makes that movement, obviously there is going to be lot of other damages. Either it can be a wear and tear, it can be a fatigability, it can be a strain, it can be a fatigue, it can be overuse, many more. Right? And as you know, there are only two types of contraction. Okay, voluntary and involuntary contraction. When you do a voluntary contraction also, there will be a muscle knots. When you do an involuntary contraction like creating a spasm, is also something which we call it in terms of which will form a muscle knots, which we will learn as by the workshop goes on. But let's understand, anything you do, if you do the movement, you're going to get muscle knots. If you don't do the movement also, you're going to do the muscle knots. Okay, how? And that is what we are going to learn for the day. Okay, of course, yes, these things are very, very, very important. Okay. In 1901, Janet அப்படின்னு ஒருத்தங்க தான் வந்து she coined this word called as trigger point. Okay, it was not so popular until John F. Kennedy, the President of the United States, got injured in the Second World War on the war field itself. So Janet did the treatment under tank. Okay, so tank na bearing மேல படுக்க வச்சு she did a treatment, and the president was much better. And next day, and she was very popular in the newspaper. And how does magic happen? Where without anything, somebody can treat somebody's pain, and that is what way she becomes so popular. In 1983, she joined with one of her friends called as David and Simon, and they have written a book called as Myofascial Pain and Dysfunction. And this book is called as Travel and Simmons book. இன்னைக்கு வரைக்கும் trigger point releaseல இருக்கிற ஒரே ஒரு book Travel and Simmons. Right? The few contents of this workshop is being taken from this book. Okay? So when I did my sports physiotherapy level 1 in the University of South Australia, it was something where we were learning more things about trigger points and what is the basic thing which happens when it comes to trigger points and how this gets injured. So this is exactly what we are going to learn into. Okay? So evolution. Right? Right. Ma'am, you mood period. Okay, so we are going to discuss something about the evolution of this trigger point release. Okay, so let's give that example, or example, and then we will relatively will do it. Okay, so 1920ல phone எப்படி இருந்துச்சு? நான் பிறக்கவே இல்லை சார், நான் தான் பிறக்கல. 1920ல phone எப்படி இருந்துச்சு? இருந்துச்சா? It was landline. Landline. Okay, have you seen this Charlie Chaplin film? முன்னாடி ஒரு டம்ளர், பின்னாடி ஒரு டம்ளர். Okay, so that is how the phone was derived in 1920. Okay, so for 2 decades we will go further. So how was the phone in 1940? Ring type இருந்துச்சு, but படாவா இருந்துச்சு. Okay, it was pretty bigger and it was rollover and it's a big size. Okay, right. 1980, 90 அந்த period. அதே ரிங் தான் ஆனா குட்டி ஆயிடுச்சு. Okay, and 1980 ல இருந்து 85 90 எல்லாம் பாத்தீங்க அப்படினா and it has become like a button. அலைபாய்டி படம் பாத்துறீங்களா? மாதவன் ஃபோன் பண்ணி பிசிஓ பூத்துல சாலினியை கூப்பிடுறது. ஆமாவா? என்ன பண்ணுங்க அப்படி சொன்னாதான் புரியும். ஓகேவா? It's exactly the same way where your PCO was in different places. அப்பலாம் ஃபோனுக்கு ரொம்ப பெரிய பணக்காரங்க. So it is exactly in that way. And later in 2000 or in 1990s and all, a cordless came, where you pull the wire and when you are talking. And next, the Karangal came. And after that, 2002, 2000 to 10, at the time of pathing abdina 1100. I don't know whether you have seen that phone. Lari edila potalme onnaga. It's exactly the same way. Achha bahut achana thirumbi the face la. Okay, so that's exactly the evolution happened. Okay, and over a period of time in 2020, what's happening now? There is no press, only thinking. Everything has become only smart, and the complete scenario is only in the whole world is in the hand. Somewhere we want to fly to Madurai in another 2 days. I told my people, check the flight ticket. They said flight is booked because the whole world is only in the hands. You need not go and search for the word. Anything you would solve it correcta. Google pannu. Amava, the whole world is in the hand. That's what exactly the revolution happened. This is not exactly the same way the revolution of the trigger point is also has happened. Earlier, people were releasing the trigger point by using a syringe needles. For assuming, Lakshmi, right? No, first time I now Lakshmi. Okay, so Lakshmi got the cultural. So that's a very severe neck pain. And I'm telling that we have to work for the sternocleidomastoid. Okay, I'm taking one big matusi, taking it, putting in the sternocleidomastoid and rolling over and telling that I'm going to do a trigger point release. Othupingla? Nama 14 varsh experience. I have it. Othupingla othumatingla? No way possible. Okay, because my body. So it's exactly the same way. The people had an apprehensiveness towards this needle, and the biggest challenge which they were facing was infection. So not able to keep this needle in sterile position, right? And that was the biggest challenge of it. So it was not so successful. And later, after the complete revolution, they understand hand is the best way to release the muscles, because I can manipulate and change the position. How I have to hold the egg and how I have to hold the brick. ஒரு முட்டையை பிடிக்கிறதும் ஒரு கல்லு பிடிக்கிற அந்த டிஃபரன்ஸை என்னால் கையில் கொண்டு வர முடியும். ஒரு pediatric வராங்க 3 years 4 years because of calf pain because he was driving his brother's cycle. So he had a severe calf pain because the brother is 8 years old. He was trying to take up and pedal, and every night there was severe pain in the calf, and the mother was giving only crocin every day to put the baby in sleep because he was suffering with pain. A gentle needle offered trigger point release followed by aquatherapy. How do you aquatherapy for a 3-year-old child? A tub of water with the ties inside, a lukewarm water in the tub. Matter over. Okay, they love playing in water. Tell them to play for 30 minutes inside the water. Sit there. Over. Calf muscle is released. SWD. I'm not telling that the machines are wrong, but we have not started thinking beyond machines. That is exactly the myth which we have to break down. Towards with your help, we can change this generation and the coming generation to be the best in the industry for what we can do it. I require that help from you. That's what we are here to work. So, this is exactly the definition of trigger point release. Somebody is going to ask you, you go to the workshop today, what did you learn? And ரைட்டா? நைனா கண்டிப்பாக கேட்பாரு. வரிசாம போனால கண்ணில் டின்னு நான் கற்றுக்கினேன், கண்டிப்பாக கேட்பாரு. ஓகே, ஸோ 4 பாயிண்ட் சொல்லி தர போகிறேன். which I'm going to teach you 4 points. கேட்டார்னா 4 பாயிண்ட் சொல்லுங்க. ஓகேவா? What are the 4 points? Okay, this is basically a definition for trigger point release. Okay, so shall we learn it together? Shall we read together? Right. Ata எதுவும் எழுதாதே. ஓகே, உங்க கிளிப் சவுண்ட் எனக்கு நல்லா கேக்குது. ஓகேவா? ரைட். Never write anything. All these slides is already sent to you in your college mail. They will definitely forward to you. ஓகேவா? உட்காந்து எல்லாம் மேல இருந்து கீழே அவர் வந்து அந்த டைப் வாட்டின பையனை வந்து அப்பா தம்பி சொன்னாரு. Don't do that. Okay, so you can write something when you feel cling. செம்மையா இருக்குதே, அதை மட்டும் எழுதுங்க. வளவளா எல்லாத்தையும் எழுதிட்டு. ஓகே, அப்புறம் எக்ஸ்ட்ரா நோட் வர கேட்பீங்க. Okay, right. So don't write everything. Everything will be sent to you via the mail. Okay. So let's read it together. I'm going to start and you're going to read it together. அங்க இருக்கிற பசங்க அந்த ஸ்லைட பாருங்க, இங்க இருக்கிறவங்க இந்த ஸ்லைட பாருங்க. Okay, ready? Shall we? Yes. Okay. So I'm going to start. You're going to read it. Okay. So let's go. Highly irritable, localized for. பசங்களா சவுண்டே வரல டே. பிரேக்ல சொக்கா. டேய் போணும். ஓகேவா? ரொம்ப சேர்த்து சொல்றேன். நான் உங்களுக்கு சேர்த்து சொல்றேன். Okay, shall we go? Right, let's go. Okay, highly irritable. எவ்வளவு அழகா இருக்கு. ஓகேவா? ரைட். இன்னொரு தப்பா. ஓகே? ரைட். பக்கா சென்னை பையன். நிறைய இந்த மாதிரி சென்னை பாஷா வரும். அட்ஜஸ்ட் பண்ணி. ஓகேவா? ரெடி? லெட்ஸ் கோ. highly irritable. Like the same way how you did it, I also did it for 3-4 times. Bloody never understood anything. Okay, so definition is all about what we have to understand, not what it is written there inside. So I have changed this definition in order derivatively in a different form. Let's go in a reverse way. It's a matter of just 4 points. 1, a skeletal muscle which will have a nodule of a taut band. That's it. Which will be excusite tender and it is highly irritable. That's it. Okay, a skeletal muscle which will have a nodule or a taut band, which will be excusite tender. Tottale valikum. Excusite tender. Adu aluthi vittingana, it's highly irritable. 4 point. Solluva? Right. First one, skeletal muscle. Second one, nodule or a taut band which is formed. Third one, excusite tender. அவ்வளோதாங்க வச்சா போவார். ஆமாவா? இன்னைக்கு நைனா வீட்டுக்கு போன பேர் கேட்பார், நான் கற்றுக்கினேன் 4 பாயிண்ட். என்ன சொல்லணும்? ஐயோ கேட்டா பட்டிசக்கா. அவ்வளோதான், இதை மட்டும் சொல்லி பாருங்க, அதுக்கப்புறம் கேட்க மாட்டேன். ஓகே, ஸோ இட்ஸ் பேசிக்கலி a skeletal muscle, a band or nodule or a taut band which is formed, okay, which is excusite, tender and highly irritable. Okay, that's exactly the definition of trigger point. Okay, so I'm going to give you a very small demonstration to understand what is this trigger point, how it is formed, why we have to learn this one. This is right. Okay, how we have to learn and why we are learning this one. I'm going to do a very small demonstration to understand how this works. Okay, 2 கருப்பு சொக்கா up. சீக்கிரம் faster. Keep going. Up, let's go. Can I have your name? Arun. I have picture examining. Okay, right. So okay, Arun, Alvin. Alphabetic order உட்கார்ந்தீங்களா என்ன? இல்ல. சரி, okay. Right. So, let's understand. ஐயா, இந்த ஒரு ஸ்லைடு புரிஞ்சுக்கிட்டீங்கன்னா the workshop is over. ஆனா இந்த ஒரு ஸ்லைடு ரொம்ப கவனம் செலுத்தணும். Okay, ready up? Right. Okay, before that, does anybody having a problem of understanding Tamil? 4 years you are in Chennai? Okay, anyway, I'll go with maximum. Only 3 people? Okay, right, fine. If you don't understand anything, please ask the next people to translate. Okay, right. Okay, ready? Shall we go? Right, fine. So, Arun, Alvin. Let's understand that Arun is an origin of a muscle. Okay, so alveol is going to be the insertion of a muscle. Let's take one small example. Arun, long get of the biceps origin. Hey, Madhu Sovata, sir, long get of the biceps origin. Hey, why I not here? Mantra Vechika, Nani Ponoka, Nani to answer. Like, I'm going to celebrity. Incessant. Long get of biceps or incessant. ரெண்டு பேருக்கு நல்ல கை தட்டுங்க. எதுக்குன்னா அடுத்தது கூட இப்ப ரெடி ஆயிட்டாங்க. வேற ஒண்ணுமே கிடையாது. Okay, the long arm of the biceps is from the supraglenoid tubercle of the scapula. Rightங்களா? The insertion is on the radial tuberosity of the radius. கரெக்ட்டா? இப்போ என்னன்னா இந்த மாதிரி ஒரு எக்ஸாம்பிளான ஒரு muscle. So origin, insertion and this is called as the bulk of the muscle. Right? Okay, now you're going to put one small knot here and you're going to put a small knot here. Okay, ready? Right, first up, knot போடுவோம். முடிச்சு போடுவோம். அருணே, ஆல்வின் ஃபர்ஸ்ட் ஆயிரா முடி போடுறல. ஏய் ஏய் தயாராச்சா? இதை நான் முறுக்கி நிற்கிறடா, நாட்டு போடுறா. அழகா நான் ஹெல்ப் பண்ணவாடா? இல்லை அப்படி போட்டால் நான் வரேன் காசா. அப்படி போட்டு அப்படி சுருக்கி அப்படி எடுத்து ஏன்டா நாட்டு போடுறல அக்க போடுறல. ரைட், ஓகே, 2 knots. Okay, so okay, so thank you. Right, so this is exactly அவங்களுக்கு வெயிட் கொடுத்துருவோம். This not only stands with the biceps, irrespective of when you come across with any inflammation which is related to musculoskeletal problems, it means that the muscle is short. For instance, a muscle which is causing Achilles tendonitis, it means that the calf is short. And how to lengthen the muscle, which we want to learn. Okay, trochanteric bursitis. Okay, Osgood Schalters. Okay, runner's knee, jumper's knee. All these are just because of muscle getting shorter and getting rub or pull at the time or the place of insertion or origin which is causing an inflammation. That is exactly where the trigger point plays a big role, because the trigger point is the one which shortens the muscle. Today, we will understand how many trigger points is there in our body and how do we release it and how the patients will complain when it comes to a problem, and those are the things which we are going to learn. Okay, so that is exactly here. So the complete is 75% of the problem which starts because of the trigger point which is involved in terms of inflammation, which will lead to a pain, which will have a referred pain. Because hope you know about the referred pains, right? So anybody, sometimes they say there is a chest pain, left hand is coming down in the problem, and if it's giving numb and tingling sensation, what does it mean? Cardiac problem. Correct? Right side shoulder, there is a pain every time when I inhale and exhale. Especially when I inhale, the pain is very bad right at the tip of my right shoulder. What is your diagnosis? Which referred pain is that? A patient is complaining, coming and saying, whenever I take a deep inhalation, my tip of my shoulder hurts. But there is no restriction in the movement of my shoulder. I am absolutely fine. But whenever I take a deep inhalation, my tip of my shoulder hurts. Whatever I am discussing with you is a patient whom I have experienced in my life. What is your diagnosis? நல்ல physiotherapist பாருங்க. Right, it's nothing other than your ups point, which is a referred pain of your phrenic nerve. It's a part of your diaphragm. Right, ups point, phrenic nerve, which supplies to the tip of the shoulder. Okay, the diaphragm refers to the same referred pain. Okay, so that's exactly where the referred pain. So like this, the muscle also has a different referred pain, which we will learn how a referred pain can cause this problem. Okay, do you know physiotherapy is something which is very simple? Only 7:37, course over. Okay, let's learn. Neck pain is no problem. Shoulder, back pain, Lumbar spondylitis. முட்டி வலினா அப்படிதான் ஓயே நீயே தான். குதிக்கால வலி வந்தா என்ன அர்த்தம்? இல்ல இன்னொன்னு சொல்லிடுறேன். கால்குலேஷன் physiotherapy over. A leg condition, physiotherapy is over. மக்களே இதை தாண்டி நிறைய விஷயங்கள் இருக்கு. ஓகேவா? Right? So, we are going to learn that. Different conditions and how subjectively they complain. படிக்கட்டு ஏறும்போது முட்டி வலி சொன்னா what is the problem? இறங்கும்போது முட்டி வலி சொன்னா what is the problem? Patient will say, sir, ஏறும்போது no problem sir. இறங்கும்போது செமையா வலிக்குது sir. Another patient will come and say, இறங்கும்போது no problem sir. ஏறும்போது பயங்கரமா வலிக்குது sir. What is the diagnosis? We are going to learn. Okay? So with the subjective complaint, how we are going to narrow down the problem? Diagnosis. It's going to make all the differences. Okay? Right. So, quickly take a scribbling pad and a pen. Faster. Right. Draw India map there. Draw India map. நம்ம ஞாபகம் பாருங்க இந்தியா மேப்மா. நீங்க வரைத இந்தியா மேப் கவலைப்படாதீங்க. Faster. Draw India map. Faster. At the bottom right, that there is an India for identification. நம்மளுக்கு எஸ்மீரே ஆரம்பிக்கல ஒன்றும். சீக்கிரம் எப்போ கன்னியாகுமரி போறது? Or India only actually. Right at the bottom, India. You wrote it? Okay, let's understand this one. Okay, pen down. Right. How many of you know who told you that India map is like this? Who told you? Sociology teacher. Social teacher. Geography teacher. ஆமாவா? உலகம் உருண்டை யார் சொன்னா? அவரே தான் சொன்னாரு. ஆமாவா? Okay, so India map is this way, the world is round. Who told you? Geography teacher told you. Correct? Right. Did we go up and see? No, but we believe. ஆமாவா? அதே மாதிரி தான் ரெஃபர் பண்ணோம். ரைட்டா? நம்மளா எக்ஸ்பீரியன்ஸ் பண்ணி பார்க்க யாரோ ஒரு மகா கண்டுபிடிச்சு சொல்லியிருக்காரு. நம்பணும். இந்தியாவை நம்புனீங்கல்ல? ரெஃபர் பண்ண நம்பணும். புரிஞ்சுதா? கருப்பொருள். Right. Now two things which you have to understand from this drawing. One, when I said you India, you are able to draw the borders. When I told you to write India at the bottom, you wrote it. This is what exactly the patient is going to complain to you. They will say, sir, pain starts from here, sir, goes all the way to the lateral malleolus, sir. This is a bordering, giving a border. With the border, you can find which country. எந்த muscle involved கண்டுபிடிக்கலாம். With the muscle involving, you can also ask them இங்கெல்லாம் வருதா. Did you understand this one? With the mapping, you can find which country, or with the name, you can draw which country it can be mapped. யாருக்கு புரியல? தப்பே கிடையாது, நம்ம கத்துக்க தான் வந்திருக்கோம். I'll tell you the meaning of the workshop little later. But let's understand. யாருக்கு நான் இப்ப சொன்ன இந்த கான்செப்ட் புரியல? கன்சோகா சார் முடிக்கிறத பார்த்தாலே தெரியுது சார். புரிஞ்சுதா இல்லையா? புரியல. Right. ராசா வாய் தட்டிக்க ராசாமே. Okay, right. We understood the India map. That's a border. Somebody is going to come and telling, sir, shoulder blade ல இருந்து அப்படியே கீழ வரைக்கும் போகுது. இதுதான் இந்தியா மேப்னு வெச்சுக்கலாம். இந்த மாதிரி கம்ப்ளைண்ட் பண்ணா இந்தியா அப்படி நம்மளால சொல்ல முடியுமா? மேப்பை காமிச்சா இந்த மாதிரி கம்ப்ளைண்டா இந்த மசில் அப்படின்னு அழகாக ரிலேட் பண்ணலாம். கரெக்டா? சம்டைம் பீப்புள் என்ன சொல்றாங்க, ஸ்பாட்டடா அந்த மசில் தான் வலிக்குதுன்னு சொல்லுவாங்க. நீங்க என்ன கேட்கணும்னா இங்கெல்லாம் வருதா அந்த கேள்வியை கேட்கணும். Did you understand? India, வார்த்தை India. Okay, right. So that is only exactly the referred pains is all about. Okay, right. So these are the few causes where your trigger points can get formed. I'm not going to go deeper into it, which you already know. Okay. One is repetitive overuse subconsciously. The sustained loading, your poor posture, your emotional stress. Okay. See, especially when this comes to an emotional stress. Okay, one thing which is very important towards this emotional stress is three muscles which gets involved very repeatedly when it comes to emotional stress. One is your sternocleidomastoid, your upper fibers of trapezius, and your levator scapulae. These are the three muscles which quickly get involved when you have an emotional stress. When I discuss with the muscles, I'll go more deeper about it. And direct injury is basically with the sports injuries and inactivity. Okay? Inactivity or immobilization. For example, I want to give you one small instance. Assuming that somebody is having a problem in the shoulder. Okay? He had a fall, an outstretched hand fall, and people said that he had a very small airline crack at the head of the humerus. Yeah? And he's been given a shoulder back, and he's been given an immobilized position for the next 3 weeks. After 3 weeks, he comes to the physiotherapist in order to rehabilitate him to get him into the normal proportion. Correct? When I keep in this position, let's explain the position. What and all the muscle will get shorter? Number one, it is medially rotated with the shoulder, right? My pec is going to get shorter. Yes, no?
Yes.
Yes. My biceps is kept in the shortest position.
Yes.
Correct? My shoulder is rotated medially. So in the medial rotation, my subscapularis or teres minor is going to be kept in the shortest position. It is kept in the shortest position. My lat, just because of adduction, is going to be kept in the shortest position. My brachioradialis is kept in the shortest position because my elbow is flexed. Clear? And followed by my pronator teres and quadratus is been kept in the shortest position because my hand is in pronated position. And this has been kept for the next 3 weeks. When I'm trying to rehabilitate immediately, so in the patient, so you have a patient, somebody like this, how you rehabilitate? What do you start with the first protocol of treatment? Wax. Mobilizing. Okay, we put a wax and we started mobilizing the. What are you trying to expect by putting a wax and mobilizing? In 3 weeks' time, you will not have a big adhesion formation and all. It's only a muscle wasting. And why a wax in the elbow and wrist? When you're trying to extend the elbow, if you start opening your biceps and your brachioradialis itself, your elbow will get extended. And when you want to go for a supination position, it will be more on the mid-prone position. So when you start releasing your pronator teres and quadratus, that's supination mode. Conservative management or treatment, like in the treatment, conservative management, the recovery takes nearly around 2 weeks to bring this movements. When you know how to release that structure and lengthen the structure by stretching that structure, you can bring the protocol of the treatment to 5 to 6 days, cutting short of 50% of the time of recovery. Okay? How many of you want to become very popular in this profession? Very popular. Very, very popular. Good. Okay. Right. Almost everybody. 3 things keep in mind. 1, the short duration of treatment, less cost, and highly effective. You are very popular. Short duration of treatment, and less cost, relatively less cost, okay, and highly effective result will make you to be very popular. Okay, whatever, right? Okay, so this is exactly to do with the causative factors. Palpation. Today morning when you came, okay, so what are the thumb, index, middle? These are the areas which we are going to use it for releasing the trigger points. Okay, but the area where I have to use and what I have to use, it highly depending upon 2 things. 1, it's a bulk of the patient, which area I have to use. Next one, the strength of the physiotherapist. Okay, hamstring is stretch pannu appadina basically physiotherapist. Patient will tell, strengthening பண்ணுவாங்க மேடம். ஆமாவா? This is the correct scenario. Okay, let me talk with something and then come back. How many of you took bath this morning? Honestly, சொல்லுங்க. போய் சொன்னா வாயில புழு கொட்டும். How many of you took bath today? எங்க பிள்ளைங்க எல்லாம் bath பண்ணலையா? பண்ணிக்கிறாங்க. Right. Good. How many of you பல்லு விளக்கி? வாடி பேசாம சார். பல்லு விளக்கி. Right. Very good. Okay. How many of you did exercise in the last 24 hours? போய் சொன்னா வாயில புழு கொட்டும். Exercise in the last 24 hours. Very good. After that, what did you do? What exercise did you do? Push-ups. What? Now question is, what did you do? Exercise did gym go pata or rendu bulk inchu parla kuduven vechi side porom like yama nammala exercise pannala illa pickla sarkar yeah exercise pannala sir இந்த பொண்ணோட மைண்ட் வச்சதமா என்ன கேட்றாங்க சார் why was not the exercise you have been done for the day is my question. Why did you don't do the exercise? Why did you not do the exercise today? There are only few answers which comes. One, palakka illa sir. We don't have that one as a habit. Second one, lazy sir. And third one, no time. No time sir. Only these three things will eventually will come. Okay, let's understand. Getting a degree, becoming a physiotherapist, not a big deal. Okay, the eligibility of being a physiotherapist is walk the talk. If you preach something, please practice. When a patient who comes to OP after doing the treatment, you're going to tell them either static quadriceps exercise or you're going to tell them do the exercise regularly so that your strengthening will happen. But you will keep on advising people, exercise. The eligibility of advising somebody is something which you have to do it first. Clear? If you don't do it, please never advise. Okay? So, please start doing exercise on a regular basis so that you will understand what is that effect which happens when you do it. So that when you design a rehabilitation, you can very precisely tell people, this is what the result which we are deservedly expecting. And that is where it will be. First time when I was there with the Indian team selection, okay, nearly around, you had a competition between 4 to 5 physiotherapists in the middle of the football court in Pune. Okay, so most of the time you will not get anything like a luxury space with the ACs and all. Most of the time it's only in the middle of the rugby court or in the middle of the football court. The coach said, Frank, that's my name. 1.5 hours, low body strengthening and plyometrics. Finished off, see you in the lobby. Coach Poider. 42 athletes. India's best athletes for the Indian team. You have to train them for plyometrics and lower body strength training. 1.5 hours. That made my selection to be with the Indian team as an Indian physiotherapist. Why? Because I did what I have been practicing. I have experienced myself, what I know that what I can do, I can handle 42 people very easily. Have you ever experienced? Somebody in this room will get this opportunity for you to do this one in some point of time. When you standing there, bloody, you're going to miss that opportunity. Currently, just this Sunday, we have been a physio partner for TNBSL, Tamil Nadu Badminton Super League. And we were with the team of Marina Dolphins, who was a winner. So, opportunities are immense when you have stuff. People never mind what you know, what you don't know until you become fit. They never mind. Monday, they never mind. Until you become fit enough in order to do what you want. Right up? I'll check everybody's fitness in this room. Right up? Fitness check. Okay? Right. So these are the basic palpable areas. So finger pads, flat pads, pictures, and we are going to use the elbow, we are going to use the flat hands. How much pressure which I have to give when you do a trigger point release? Very simple. If you grade it from 1 to 10 of your pressure, we should stand between 4 to 5. The understanding is it should be bearable because it's highly tender and it's very highly irritable. You have to palpate in such a way where it is going to be something very subtle and it is not so painful. So bearable level pressure is what we are going to exert. Okay, that's what we are going to do towards our model. Right. Classifications. Okay, so there are only 4 classifications: central, satellite, active, and lateral. Right. What is this central? The trigger point which is present in the bulk of the muscle is called as central. Okay, we're going to repeat it. The trigger point which is present in the bulk of the muscle is called as central trigger points. Satellite is, the problem is somewhere else, the effect is somewhere else. Okay, so and that we will be calling as a satellite trigger points. Okay, so the active trigger points are the points where they are giving a problem right now. Okay, currently they are giving a problem. Okay, it means it's paining, and that is called as active trigger points. Latent trigger points, a better way to understand is எந்த ஏரியால பாத்தீங்கன்னா ஒரு தாதா இருப்பாரு. ஓகே, அசிஸ்டன்ட் தாதா ஒருத்தர் இருப்பாரு. அசிஸ்டன்ட் தாதாவோட எவ்ரிடே பிரேயர் எப்ப தாதா சாவாரு, then we can become தாதா. That is called as latent trigger. Active எப்போ நீங்க சப்சைட் பண்றீங்களோ latent தலை தூக்கின்னு நல்ல ஒரு வார்த்தை நம்ம ரிலீஸ் பண்ணும்போது ஆக்டிவையும் ரிலீஸ் பண்ணணும், latentயும் ரிலீஸ் பண்ணணும். How to connect these dots we will teach you. Right? So let's understand that only 4 classifications. One is central, active and latent. Central is satellite, cause somewhere else, the effect is somewhere else. Okay, the third one, active is directly giving the pain. Latent is somebody who is hidden and they will become active very soon. That is exactly where your latent is all. Okay, so that is central. Okay, so muscle shape and location. It's very fairly easy to hold this muscle. Okay, what is this condition? The red spots are the pain. Okay, so what is this condition is called? Sciatica. Okay, no doubt? Sciatica? Correct. The patient who complains with the pain in the butt which comes down completely and they say, okay, there is where the complete pain in the left area. So it says it's called as lately we understood that is exactly the referred pain of gluteus medius muscle. And this is your gluteus minimus muscle. Yesterday evening I had a patient with this symptom. Actually, now put the India map here. When somebody said that inga da valigudhu, ipo na sonna muscle naanga varuma? Gluteus medius. இதுதா இந்தியா மேப். Patient will complain, sir, தொட வரைக்கும் ஒரு patch இருக்கு சார், அதுக்கு அப்புறம் காஃப்ல ஒரு patch இருக்கு சார். மினிமஸ் எல்லா பெயினும் sciatica கிடையாது. That's the point. SLR also will be positive, but not all the pains are more related to a sciatica. நிறைய கேள்வி கேட்பேன். My questions will always make you to think to the next level. Okay, like assuming this condition here. Okay, so it has been derived as 5 different problems. One, sinusitis, and the second one, trigeminal neuralgia, and the third one, facial neuralgia, sometimes migraine, and sometimes vertigo. 5 conditions. Shall we repeat? First one, sinusitis, trigeminal neuralgia, facial neuralgia, migraine, vertigo. And that is exactly when people come and saying that, sir, there is a severe pain in the cheek, behind the head, on the tip of the head, sometimes in the chin area where it is giving. Most of the people, they think it's more of a dental problem. But understand, once you start releasing your sternocleidomastoid, all these problems are shut in less than 3 sessions. The people who come with vertigo, taking a Vertin 16 for almost 2 to 3 months, start working on the sternocleidomastoid, your hands will make magics. Till date, we would have crossed more than 300 patients of working with sternocleidomastoid for vertigo. Another தைரியமா சொல்றேன். புரியுதா? ஓகே. இங்க இருக்கிற நிறைய பேருக்கு sternocleidomastoid டைட்னஸ் இருக்கு. அந்த மசில் வரும்போது படிக்கும். ரைட்டா? நம்ம ஃபோன் எடுத்து வர பாப்போம் அந்த டைம்ல. Okay, so பார்க்கலாம். Right? So this is exactly this is basically, as I said, satellite trigger. The cause, okay, so the cause is somewhere else, the effect is somewhere else. Okay, the cause is somewhere else, the effect is somewhere else. The cause is somewhere here, the effect is somewhere here. And this is called as satellite trigger. Active trigger points are basically, we'll have a local twitch response. நீங்க தட்டு பாத்தீங்கன்னா twitch தெரியும். அதே மாதிரி நீங்க கரெக்ட்டா அந்த மசில் மாடலோட பிராக்டீஸ் பண்ணும்போது you will understand when the moment you touch your model will say twitch response. Active trigger present there, confirm. Right? So this is about the latent trigger. Not aware of this exists, you will not be aware that it exists, and it has never experienced recently in your body. but it will come up once it goes. You will see patient complaining, sir, right leg pain, அப்படியே left வந்துச்சு சார் சொல்லுவாங்க அவங்க தான் லேக்கன்னு. Have you heard about this statement? சின்ன கோடு பக்கத்துல பெரிய கோடு comes down, the சின்ன கோடு is more prominent. That is totally different from this. Okay, this is more to do with your lateral trigger. Only 4 classifications: central, satellite, active, and okay, just a brief. Okay, so the trigger points becomes more intensive depending upon these factors. One, where they are located, the degree of trigger points, and activa the latina in the central or satellite under the பொறுத்து அதே மாதிரி site எந்த இடத்துல trigger point இருக்கு அது எங்க locate ஆயிருக்கு. Age factors are very important when you work on the trigger points, and also the last one is your chronicity of your trigger points. Sometimes it becomes very thick and banded. How the chronicity works, and that's what exactly which we are going to learn. Okay, so there is one particular muscle which we call it as universal trigger point. Hold on, right. The universal trigger point is nothing other than your brachioradialis muscle. Why? Abdina, without this muscle, you cannot do any activity on your upper body. By isolating this muscle, you cannot do any activity on your upper body. Take few examples. Okay, so removing a spectacle and putting a spectacle, my brachioradialis is going to work. Combing a hair, my brachioradialis work. Adjusting a shawl is going to work. Putting a tag is going to work. Combing a hair is going to work. Putting a dress is going to work. Anything you do in your upper body, this muscle will be working. You cannot isolate this muscle, and that's why this muscle is called as universal trigger point. Right? Right. Unga left elbow bend panning. Follow my instructions, you will be able to understand. Okay? So, right thumb on the left brachioradialis. Okay, you have to place in this direction where your fingers are placed above. The thumb has to be there. Slightly bend the elbow. Keep it in the lap. Don't carry it. Keep it in the lap. Slightly bend the elbow. Hold it on your brachioradialis area. Right. Go medially and laterally. Go medially and laterally. You will find a pain there. ஒரு சின்ன ஒரு டக்கு தெரியுதா? ஒரு நாடியூல் ஒரு டக்கு தெரியுதா? ஒன்று ஆனாட்டும் இல்லை ஆனாட்டும். எஸ் சார். ஐயா அந்த போட்டு பின்னாடி உட்காந்து ஒரு 5 பேர். தெரியுதா சாமி? ஐயா கட்ட போட சொக்கா. தெரியுதா? ஓகே. ஸோ நீங்க பிடிங்க உங்க மசில் பிடிங்க. ரைட். ஓகே. ஸோ லெட்ஸ் ரிலேட் த டெஃபினிஷன் ஹியர். Skeletal muscle. ஓகேவா? Nodular band. That is what you are feeling is a band. ஓகேவா? ரைட். Extensor side tendon. அதுக்கு போய் தெரியுதா வலி? அழுத்தி புடிச்சு பாருங்க. ஐலி இருக்கு. புடிங்க. அந்த ஒரு நாட் ஒன்னு இருக்கும். அந்த நாட்டை வந்து அழகா அப்படி பிரஸ் பண்ணி அப்படி ஹோல்ட் பண்ணுங்க. Thumb, index and middle finger, you will feel a referred pain. If you have a trigger. Right. Now check the other side. Right side. Sometimes right side will be more tighter than the left because of your dominancy. But not necessarily always. Okay? More medially and laterally. You will find a click and you will have a pain. When you compare the right and left, you will feel the pain is more here. At times. But not always and not necessary. It should be always. Okay? Right. So, relax. So, this is exactly your universal trigger point. Okay? So, that's about your brachioradialis. There are few techniques which is used in trigger points. Okay? One is gentle kneading. This is called as gentle kneading. Another one which is called as ischemic compression. There are only 2 techniques which has been used. Gentle kneadings are very smooth movements, okay, which you use your massage techniques of your massage movements and pulling the soft tissue and pressing the muscle. Right. If it's going to be an ischemic compression, you will find the nodule, you press the nodule for more than 20 seconds with the maximum pressure. Let's understand this one very clearly. Your ischemic compression is very effective 8 times more than gentle kneading. Your ischemic compression is 8 times more effective than gentle kneading. But 25 times more painful. 25 times more painful. That's the reason why we don't use this one in the clinical practice. The first day if you see the patient, next day the patient will not come. Annamma kita phone avithudu sir. Vali urru neerukku sir. This will be the statement. On the consultation day you would have told them 10 நாள் வரணும் ட்ரீட்மெண்ட்டுக்கு, 15 நாள் வரணும் ட்ரீட்மெண்ட்டுக்கு, 3 நாளுக்கு அப்புறம் தான் வர மாட்டாங்க. ஏன்னா ischemic compression is 25 times more painful. That's the reason we use the ischemic compression techniques mostly on the sporting population, not with general publics. Okay, in general public, it's always which you use it is your gentle kneading technique. And whatever we are going to teach you today is also, it's all about the gentle kneading techniques. Okay, so this we are going to hold your stuff now here. Okay, so we are going to learn. Okay, so we are going to hold and one thing, yeah. Now one last question and we will get into the practical part. Okay, and we are getting into the muscles. Okay, so one question. Right, there are two types of people who work in the system. Okay, the people who deal with numbers or the people who deal with words. There are only two types of people who work in the system. People who deal with numbers, for example, financial planners, bankers, okay, so auditors, or the people who deal with numbers. The people who read the mail and reply, or drafting a letter, or content writer, all the people are the people who deal with words. Who gets more injured in the neck and the shoulder? The people who deal with numbers or the people who deal with words? Numbers எல்லாம் கை தூக்குங்க. Right. Words எல்லாம் கை தூக்குங்க. ரெண்டுத்துக்குமே கை தூக்காதவங்க என்ன சொல்றீங்க? யாக்கா சோப்பு சொக்கா ரெண்டுத்துக்குமே கை தூக்கல நீ. ஓகேவா? Right. So the people who deal with numbers or the people who deal with words. The people who deal with numbers are more involved in injuries than the people who deal with words. Why? Because of concentration. 10 லட்ச ரூபாய் பேங்க்ல டெபாசிட் பண்ணி ரைட் சைடுல எக்ஸ்ட்ரா ஒரு சைபர் போட்டா எவ்வளவு நல்லா இருக்கும். நம்ம வம்சமே உட்கார்ந்து சாப்பிடும். ஆமாவா? So whenever they deal with numbers, they need to focus a lot. They always popped in. They are peeped in because they want to focus, because tally avari. Right, now words they sit, they relax and do it. Okay, so the people who deal with numbers. So on your assessment sheet or in your case sheet, name, gender, occupation. When they fill that occupation, relate with this profession. Okay, how many of you know? Okay, big man. Do you know that the flight has a brake? Flight க்கு brake இருக்கா இல்லையா? ஃபர்ஸ்ட் கேள்வி. இருக்கு. அம்மா சத்தியமா இருக்கு சார். இருக்கு. எங்க இருக்கு? எங்க இருக்கு? எங்க இருக்கு? ரெக்கை இல்லையா? ஐயா பைலட் எங்க பிரேக் பிடிப்பாரு கேக்குறேன். இருக்கு. கேபின் இல்லையா? நம்ம கார்பெட் ஏரியால லாபரட்டரி ஆமா வெப்பாம பிரேக் நம்ம கார்பெட் ஏரியா தான் எங்க இருக்கு? கையில இருக்கா? அதுதான்மா வேணும். அப்பா ஹரியா பிரேக் எங்க இருக்கு? நானும் அப்படிதான் நினைச்சிருந்தேன். ஒரு பைலட் ட்ரீட் பண்ற வரைக்கும், ஒரு விமன் ஃப்ளைங் ஜெட் பைலட் ட்ரீட் பண்ற வரைக்கும் நானும் அப்படிதான் நினைச்சிருந்தேன். ஃப்ரம் இந்தியன் ஆர்மி. அன்னைக்கு தான் அந்த அம்மா சொல்லுச்சு, the brakes are in the legs. Especially when you are driving a Boeing 302 or 307, you and your co-pilot has to hit the brakes simultaneously at the same time to stop the aircraft. It will swing. That's why without a co-pilot you cannot land the aircraft. So the brake is in the leg. Then only went to the YouTube and started learning about the cockpits, which I learned more things about the aircraft. What is the movement? How the seats rotate? The seat doesn't rotate 360 degrees, it rotates only 180 degrees. Where the approach is, where the pad is, where the throttle is, where the accelerator is, where the knots is, how frequently they lift their hands and down, take the turns of the flight. So you know, learning after seeing one profession from that related problem. Like this, nowhere where you have to tell as a physiotherapist, this and all not necessary, only this required for the treatment. No, not like that. You have to learn everything and you should have a knowledge on everything and anything. Right? So the more you are knowledgeable towards the something which is beyond the books, and you will be pleased more. There are only few signs, as I said, jump signs and twin signs are the basic signs. And there are a few physical findings in order to find how the trigger points is involved. One is, as we saw, tightness in the muscle. spot tenderness இருக்கும், ஒரு large lump இருக்கும், இல்லை taut band இருக்கும். It will have a effort pain. The skin over the trigger point will be lightly warmer, or sometimes the skin will be little rough over where the trigger point is present, and the skin loses its elasticity when there is a trigger point at the bottom. Okay? In the muscle narcissism, let me put a very small, very easy definition. Okay? 4 and more ZAP bands together forms a nodule. That's it. In South Korea, there is ZAP bands. 4 or more ZAP bands forms together and form a nodule. Too many nodules forms a band. That is what you are palpating. Clear? Right. Okay. This is what exactly. A small brief about trigger points. Still, there is a lot of theories to understand what the indication, what is the precaution, what are the contraindications in going to trigger point release. If you learn Kumar, ஒரே தேரியா பார்த்துங்க, அப்புறம் நான் தூங்க ஆரம்பிச்சிடுவேன். ஓகேவா? இப்போ என்ன பண்ண போறோம்னா நோட்டெல்லாம் வச்சுட்டு ஏஞ்சி நீங்க போறீங்க. Okay? And very importantly, listen. Okay. You're going to move from your seat and you're going to be on that vacant area and this vacant area and this area and all you're going to stand. Okay, ready up? Go. Faster. The first muscle or the only muscle which you have to work is your lower rectus abdominis. Clear? When people say that long standing or sitting to getting up, sitting in a chair and getting up is hurting on my back. Okay? So என்ன சொல்லுவாங்கன்னா சார் எங்கனா போய் நின்னா ரொம்ப வலிக்குது, ஒரு 5 நிமிஷம் எங்கனா உட்கார்ந்தா திரும்பி ஒரு 1/2 மணி நேரம் நிக்க முடியும் இப்படின்னு சொல்லுவாங்க. So it's purely understood that your rectus abdominis is shorter. Clear? The pain will be more on the horizontal side of your pain. People will say this is where exactly it hurts. Clear? And one muscle which you have to work is your lower rectus abdominis muscle. So you have to work on the lower rectus abdominis muscle. Clear? Right.
ஸோ நம்ம இன்னைக்கு பார்த்தா வந்து மயோஃபேஷியல் ட்ரிகர் பாயிண்ட்டுடைய ஒர்க் ஷாப் தான் பார்த்தோம். இந்த ஒர்க் ஷாப் வந்து எங்களுக்கே தெரியாது, ஸோ எங்களுக்கு இது புதுசு தான். ஸோ இன்றைக்கி நாங்கள் எப்படி இருக்கோம் ஒர்க் ஷாப் பார்த்தா எங்களுக்கு ரொம்ப சக்ஸஸ்ஃபுல்லாக இருந்துச்சு. ஸோ தெரிஞ்சதுக்கு நிறையா விஷயங்கள் இருந்துச்சு. லைக் ஒவ்வொரு மசிலுக்கும் எங்கெங்கே இது பெயின் இதாகுதோ அதுக்கெல்லாம் எந்த இது சொல்லி ஆரிஜினுடைய அதான் எல்லாம் ஒரு கம்ப்ளீட் டீட்டெயிலாக வந்து நம்மளுக்கு இன்றைக்கி ஒர்க் ஷாப் வந்து ரொம்ப சக்ஸஸ்ஃபுல்லாக இருந்துச்சு.
ஒர்க்ஷாப் வந்து ரொம்பவே யூஸ்ஃபுல்லாக இருந்துச்சு. சார் வந்து ஃப்ராங்க்லின் சார் வந்து நாட் ஒன்லி அபவுட் எப்படி அதை ப்ராக்டிஸ் பண்ணணுன்றத விட ஹவு டு அசஸ் அ பேஷண்ட், எப்படியெல்லாம் கண்டிஷனில் வருவாங்க அண்ட் ஹவு டு ட்ரீட் தெம் அப்படின்னு சொன்னாங்க. அண்ட் மோஸ்ட்லி ஹேண்ட்ஸ் ஆன் டெக்னிக்கும் இருந்துச்சு. ஸோ வி ஹேட் அ ப்ராக்டிஸ் செஷன் ஆல்சோ. நெக்ஸ்ட் வந்து இன்னைக்கு வந்து மேஜர் மசில்ஸ் நிறைய பார்த்துருக்கோம். இன்னும் டே 2ல நிறைய கற்றுக்கணும்னு சொல்லியிருக்காரு.
ஆக்குபேஷன் ரிலேட்டடாக எவ்வளோ டிசீசஸ் இருக்குது அண்ட் ஒரு சின்ன சின்ன விஷயமும் ஒருத்தவங்களோட லைஃப் எவ்வளோ பெரிய இம்பாக்ட் க்ரியேட் பண்ணுறது தெரிஞ்சிச்சு. தென் ஆக்டிவிட்டி ரிலேட்டடாக அந்த செஷன்ஸ் எல்லாமே ரொம்ப யூஸ்ஃபுல்லாக இருந்துச்சு.
Workshop was very useful, very informative. I feel that we got this beneficial knowledge out of the box. We were thinking and we answered a lot of questions. It was a very interactive session. I feel that this will actually help me in a long term. There was a lot of practical knowledge that I could sense all around. It was a very beautifully presented webinar.
It's been a great pleasure to be with you all this afternoon. So Dr. M.G.R. Research University and ACS College of Physiotherapy, they've been doing a very grand way of doing this workshop of trigger point release. We're very happy to share the knowledge. And of course, yes, a very interactive session. We've been trying to open up the mind of the students in order to see the next generation getting much better The faculties and the students are very cooperative towards whatever we've been in terms of doing or enhancing this profession for the next level. So thank you so much for the institution, the principal and the faculties of physiotherapy of Dr. MGR Medical University and College of ACS College. So looking forward to much more sessions to come forward. Let's enlighten together and let's make the profession much more better and bigger and better. Thank you so much. Thank you. Take care.